Welcome back. Covering your health. November is Diabetes Awareness Month, and in Oklahoma, thousands of people are diagnosed with diabetes every year.
Joining us more to talk about it is Dr. David Sparling with OU Health's Hamm Diabetes Center. Dr. Sparling, thanks for joining us. We appreciate it.
Happy to be here.
Yes. So there is a lot of talk about it this month, awareness, just talking through some things. Type 1 diabetes is what we're focused on today. What is that, and what do people need to know about it?
So there's, like you said, several types of diabetes out in the world. Type 1 is, if you think about insulin being the keys that lets your body absorb the food that you're eating, especially sugar. Type 1 is you've lost your keys. Your body's attacked itself, and the only thing we can do is give you back insulin. So it's not a lifestyle choice or things like that. It's much more an autoimmune disease, and about 1 in 300 people walking down the street are dealing with it.
Wow.
What are some of those risk factors? And some of those factors are that you can control.
Yes. So anybody with type 1 diabetes, their family members are at a higher risk than the general population. So my family's been dealing with type 1 diabetes for a long time, about 1 in 20, chance, as opposed to 1 in 300. And it's a lifelong illness that we have to deal with, so it becomes a factor of checking your blood sugars with every meal, taking that insulin with every meal, and just trying to keep everything smooth and easy.
Is there any warning signs before you're diagnosed that maybe parents could watch out for?
That's a great question. So more lethargy, a little more exhaustion, increased urination, increased thirst. Those are kind of the big ones, kind of at the last step. But that's what catches so many families off guard, is that it can be subtle and slow. And we just say, make sure you get to your doctor.
We see a lot of new medications for diabetes. Are those good for type 1 or are they for the others?
A little bit of both these days, actually. So while classically most of the people in the United States have type 2 diabetes, there's more and more research, both at the Hamm and across the nation, into type 1. And one of the newest drugs just got approved in the past few months, and we're excited to be bringing it here to Oklahoma here soon.
You've said this statistic earlier, 1 in 300 people walking around with type 1 diabetes. What, as far from an awareness perspective, what do you want people to know that are watching this morning?
That there is an increased risk. And so if your family has been dealing with type 1 diabetes, there is an ability to get screened to find out if you have diabetes before you have symptoms. That decreases your chances of showing up in the hospital being ill. It decreases the risks of long hospital stays and all of that. So if your family members are dealing with it, talk to your doctors and see what's available for the screening and treatment.
It's really amazing how far the technology advancements have come.
Yes, no, that's one of the most exciting things these days. You know, 30, 40 years ago, it's just, you know, check your blood sugars, take your insulin. I've got, you know, 2, 3-year-olds on insulin pumps these days. Their families are able to control their insulin doses with their phones, and it's pretty amazing.
Yeah. Well, Dr. Sparling, thanks so much for what you do at the Hamm Diabetes Center here for OU Health and coming in and talking with us today.
Happy to be here. Thanks for the chance.
Thanks, Doc. All right, 9